My name is Suzanne Prentice, and I'm the coordinator of the Live Well Kalkaska Substance Free Coalition, and I'm also the prevention specialist for Kalkaska County with Catholic Human Services Up North Prevention. My son was given an opioid medication at the age of 14, and he developed a substance use disorder as time went on. As a parent of someone with a substance use disorder, a lot of times you feel isolated. Like you can't talk to anybody, you feel like you're always being judged, and as a parent you judge yourself enough. And just like our children or our loved one that has a substance use disorder, they also judge themselves. Family members sometimes, friends, they often, tell you, well, you need to do this or you need to do that or you're doing this wrong. And like I said, we judge ourselves anyways. And the truth of the matter is we didn't cause it, we can't control it. Nothing that we did caused the substance use disorder. It was a combination of a bunch of different things, from genetics to trauma, childhood trauma, environment, age of first use, which, like in my instance, my son was given the medication by a doctor. So we don't control those. Going to the doctors with my son, or to the hospital when he would overdose or get sick from infection or something like that. You go in there and the attitude of the medical staff sometimes is poor towards him and myself too. They look at you like you must not have been a good parent in order for this to happen. We've had a lot of overdoses the last several years, and sometimes I think they think that they're just a waste. It's a waste of their time. I actually had a nurse when we were in a hospital a few years back, pretty much told my son he was a waste of a bed. The bed could have been, put to better use. Every life is important and everybody has a purpose and everybody does have a right to live. And we just, like I said, we need to be kind. We don't know the whole story. It's really hard because, in our society, in a civilized society, we need to understand that when we further traumatize, a lot of these people have been, gone through traumatic events, and we traumatize when we use stigmatizing language, when we're less than kind to people. Being compassionate, you can be compassionate and still hold people accountable. We don't have to further traumatize already traumatized people.